Hi, this is Haley Moore doing simpath 410, competency 3. So basically, to begin with, the lady that came into the emergency room with a cat scratch and that she'd had a knee replacement 6 weeks prior, I feel like the hospital fell through. They should have made her a 24-hour observation patient, admitted her, did the wound culture of the cat scratch and see what antibiotics it was sensitive to. Also, too, they probably should have did some more diagnostic testing with her saying that she was unable to walk without her cane where she previously had been. Maybe an MRI, CT to see what was going on with the knee. And obviously, too, if she'd had the sensitivity going out, they would put her on the correct antibiotics and she probably would not have got septic, maybe. So that was a fall through of the hospital. Now, do I feel like hospitals should be reimbursed for mistakes, healthcare acquired infections, or hospital, cause deaths, errors, whatever? No, I don't. Let me just give you a couple of statistics, which is from the CDC. Okay, in 2011, you had the chance of 1 in 25 people developing a healthcare acquired infection. Now, today, 2015 census, you had 1 in 30, like I said, 1 in 31 chance of getting a healthcare acquired infection. So it improved from 1 in 25 to 1 in 31. But that's still way too high. They have benchmarks for 2015 to 2020 that they want to decrease those even more. You think about it, these numbers that I'm fixing to give to you. Okay, 2015, 3% of people that's hospitalized had a chance of having one or more hospital-acquired infections. That's 687,000 people in 2015 had a hospital-acquired infection. You think if you're one of those 687,000 people. Or, this is even a more scarier statistic, 72,000 die during hospitalization due to healthcare-acquired infection. But on the rainbow side of it, in 2015, you're 16% less likely to get a healthcare-acquired infection than you were in 2011. So I think that has been improved because hospitals have tried to improve their statistics because, like I said, I don't believe hospitals should be reimbursed, because it costs insurance billions of dollars for these hospital-acquired infections. The antibiotics are more expensive. You end up on ventilators, longer hospitalization, etc. I feel like that the hospitals should have to pocket that cost. So. Also, I'm not the only one that thinks that. That's why several organizations such as AQUAF, CMS, different things monitor satisfaction scores now with hospitals. Satisfaction scores, the higher your satisfaction score is, the higher your reimbursement. Your satisfaction score is low, you don't get reimbursed. You do not get reimbursed for healthcare-acquired infections such as healthcare-acquired pneumonia, healthcare-acquired UTI, healthcare-acquired pressure wounds. You do not healthcare-acquired C. difficile. You do not get reimbursed for those. So incentives, like I said, for the hospital, of course they're going to do better because they're going to be reimbursed better if they have less, like I said, better satisfaction scores. So that's going to cause them to increase the education of their employees and make rules and regulations tighter. I think that is a very good thing. Then also too, another way, if their satisfaction scores are low, they're not going to be reimbursed as well. Or if they have a lot of those healthcare-acquired infections, they're not going to be reimbursed for those. So that is what I think. How do I think two ways that can help improve errors and improve patient safety? Number one, education on hand washing. We have infection control that stands outside of rooms and does audits on whether people are correctly washing their hands or not. Because unfortunately, C. difficile is mostly a hospital-acquired infection, and it has to be hand washing with plain soap and water, not alcohol gel. And that is a fecal to oral root spread, and it does tend to be spread mostly by healthcare workers. So that's one thing there: education on hand washing and making sure that the people are actually doing that. Also, too, medication scanning. Basically, most hospitals have this simpath now. you have to scan the medication, scan the nurse, scan the patient. That ensures that the correct patient gets the correct medication and the correct dose. There is ways around that, and nurses who, hospitals that have that medication scan safety thing, there is a percentage that has to be scanned, and if it's lower than that, then you get counseling and get talked to corrective action because they don't want the patient to receive the wrong medication. That's two ways. Monitor hand washing and medication scanning. Those are two ways to improve safety of patients. Like I said, and then, of course, hospitals, incentive for them to do better. If you do better, lower infection rate, lower hospital-acquired infections, better quality score, you get reimbursed better. So that's real simple of why they would do better. That's the incentive. They get paid more. The more they get paid, the more hospital, and the encouragement for you to do better, the more they get paid, the more likely you are to have better more hospital staff. The more hospital staff you the more hospital staff you have, the less likely to make errors and commit these being in a hurry, not washing your hands type of things. So that's why you need to do everything you can to get infection down, get reimbursements up, and then you have more reimbursement, you have more hospital staff, and better patient quality, better patient care. Everybody's happy. Thank you.